We are currently doing some urology procedures, mainly robotic-assisted prostatectomies and GYN cases, laparoscopic hysterectomies, things like that. Pretty much just about anything that you can do laparoscopically, you can do with the robot, but it's one step further in technology, one step more advanced in patient care.
That we use the robot for laparoscopically, the 3D vision that you get with the robot, as well as the magnification that you get looking at the tissues, and the ability to dissect the tissues so finely with the robot that it gets to the point of giving the patient a better operation, probably ultimately, in that there's less blood loss, less time in the hospital as a result of the minimally invasive approach, and also the patient can have less pain because of the way the robot interacts with the patient on the table.
The robot is another way to do minimally invasive surgery with more results like you would have if you were doing an open case where the surgeon actually had their hands in the patient, but it's little small incisions rather than a huge one. So, for example, a prostatectomy, we can do 6 small incisions that are about the size of a pinky finger, versus with an open prostatectomy, the patient would have an incision about this long.
And we also see that the advantages of being able to dissect the tissues more finely, as Amy was talking about, potentially sparing nerves in other tissues that might be damaged with the open procedures or with the laparoscopic procedures. Because most of the instruments that we use for that are larger and more. It's more difficult to see the tissue planes that we dissect in those cases. So it's really becoming very popular among our subspecialty and growing by leaps and bounds every year. And I expect that it's going to be a major part of our technology to treat patients here in Wilmington and the surrounding area. A lot of people have transitioned to laparoscopic approach for endometrial cancer, hysterectomies, and node dissections. But the robot is, I think, a technological step in advancement to the laparoscopy because of the 3D vision and the ability to dissect those tissues so finely and with such great precision.